A wonderful movement reference we can use to explore as we move through backswing in particular, allowing that kind of trail hip to elevate and move upwards. So as you kind of rotate through backswing, because the pelvis is in an incline, it's into forward flexion. As we rotate back, not only does the pelvis rotate, but it also rotates so that trail side elevated, not literally kind of moving upwards. It's not a change in position, but the trail side is moving upwards relative to that lead side. Why? Because we rotate around that kind of forward flex start position. If we stood upright and rotated, crudely speaking, that pelvis will stay level, but because we rotate in that forward flex position, that trail side will move up. So more than almost an anatomical reference, a movement reference we can play with, really standing on one leg, and it very much then connects into just play with and make that own observation around your own levels of control and range that you have. So in that start position, sit on that trail leg without collapsing through that trail knee, without kind of dropping through the pelvis, without losing control through that trail foot. We then just start to drop the lead hip downwards and then pick up that kind of lead hip. So we can be drop down, pick up the lead hip, drop down, pick up the lead hip, drop downwards, pick up the lead hip. At all times, control that trail foot, control that trail knee, so we're not kind of losing the control, so we're not dropping through the pelvis. And this can be a wonderful way of exploring the awareness as we move through back, so allowing that trail hip to move upwards, that femoral head, the top of the femur, to move up into the hip joint, the acetabulum, for those that are more aware of more the anatomy. So how do we get that hip to move up, that femoral head to drive up into the pelvis, to create that lovely kind of compression, that connection in the joint, not kind of the joint being compressed, but lovely stimulation kind of through that hip joint, which in many ways connects into the idea of joint loading rather than, say, weight transfer. So once again, into that start position, control the pelvis, control the knee. Can you just drop and lower down that lead hip, pick up that lead hip, drop down that kind of lead hip, pick up that lead hip, to really encourage then the awareness of, as we move through backswing, the push into that trail foot, the movement up through that trail hip can be a wonderful way of exploring then, which actually connects into the ideas of joint loading rather than weight transfer, but in that very much that playful way as you bend to that start position, as we rotate back, that trail hip moves upwards. This can be a lovely way of exploring and how to encourage that movement of that hip upwards as you control how that pelvis moves, and also then the control through that kind of trail foot, trail knee.